Thank you, Chairperson, kind introduction. I'd like to talk about the fibrosis and heart failure. So this is my conflict of interest in this presentation. As you know, cardiac disease is one of the leading causes of death in the world, including Asia. So this result of the pure study published in the Lancet. So cardiovascular disease is a cause of death, and this population is about 40%. So cardiac disease, such as hypertension or myocardial infarction, causes heart failure, which is known as a pathological condition with poor prognosis. So I would like to show the guideline for treating heart failure issued this year by Japanese Circulatory Society. The basic drugs for heart failure with reduced ejection fraction HFrEF is the ACE inhibitor, ARB, ANI, beta blocker, MRA, SH inhibitors. These four drugs are called Fantastic Four. However, the drugs indication for heart failure preserves ejection fraction HFrEF are only SH inhibitors. So since most heart patients, especially the HFrEF, are not satisfied with current pharmacotherapy, so we need new drug to improve the prognosis and quality of life for heart failure, especially HFpEF. So persistent stresses such as hemodynamic overload or myocardial infarction, risk cardiac inflammation, and cardiac hypertrophy and cardiac fibrosis. So eventually result in the heart failure. The suppression of cardiac fibrosis would be a strategy for heart failure therapy, especially HFpEF. But the ideal target molecule for anti-fibrosis therapy has not yet been identified. So during myofibril differentiation, various gene transcription is altered by epigenetic regulations. So in cardiofibrosis are activated by epigenetic regulators such as HAT, methyltransferase, and so on. However, we consider that the other epigenetic regulators also contribute to cardiac fibrosis. We focus on the protein arginine methyltransferase PRT5, which is an enzyme that symmetrically demethylates the arginine or protein such as histone and transfractures. It is involved in the various cellular processes, including cell growth and differentiation. So epigenetic regulation of fibrotic gene is important in myofibril differentiation, but PRT5 function is not well studied. This slide shows our hypothesis. PRT5 is an essential epigenetic regulator of myofibril differentiation during heart failure. Here we aim to determine the role of PRT5 in cardiac fibrosis using knockout mice and cell culture studies. To knock out PRT5, especially in fibroblasts, periodicity macrolema mice were recrossed with PRT5 flox mice. This is an expected procedure. Using a TAC model of pressure overload induced heart failure, we analyze the PRT5 function in cardiac fibroblasts. Echocardiograph analysis showed that the cardiac function, especially the flux shortening, is reduced by TAC surgery, but significantly improved by PRT5 knockout in fibroblasts. This slide shows a historical analysis of cardiac fibrosis after TAC surgery. The red portion shows the excessive collagen. Cardiac fibrosis was significantly increased by TAC surgery, but PRT knockout in fibroblasts reduced this increase. A similar result was observed in the other fibrosis-specific PRT5 knockout mice. So these results suggest that PRT5 in fibroblasts is required for cardiac fibrosis. Myofibril differentiation is essential to induce cardiac fibrosis. Alpha-SMAR is a marker of the myofibrillast. We examine alpha-SMAR positive cell in heart after TAC surgery. The number of alpha-SMA positive cells were increased by TAC surgery, but PRT5 knockout decreased it. Alpha-SMA and periostin are known as fibrogenes. We examine fibrogene expression in heart after TAC surgery. PRT5 deficiency in fibroblasts replaced fibrogene expression by TAC surgery in heart. These in vivo data indicate that PRT5 in fibroblasts is required for cardiac fibrosis associated with heart failure. We then try to analyze the mechanism by which PRT5 regulates fibrogene transcription in cardiac fibroblasts in vitro. In primary cultured cardiac fibroblasts, PRT5 inhibition using EPZ and knockdown by siRNA suppress TGF-beta-induced fibrogene expression. Additionally, PRT5 inhibition and knockdown suppress the alpha-SMA protein expression. These data suggest that PRT5 is required for TGF-beta-induced myofibroblast differentiation from cardiac fibroblasts. As shown above, PRT5 MET transfer inhibitor methylated histone H3R2 to promote gene expression. Here we performed chip analysis in cardiac fibroblasts. TGF-beta increased H3R2 demethylation at collagen 1 and alpha-SMA promoter sites. This increase was suppressed by PRT5 inhibitor PPZ and knockdown, suggests that PRT5 methylated H3R2 demethylation by TGF-beta stimulation in cardiac fibroblasts. SMAD3 is an essential transfer factor to promote fibrogene transcription after TGF-beta stimulation. We examine the interaction between PRT5 and SMAD3. This protein assay revealed that PRT5-SMAD3 interaction MH2 domain of SMAD3 is required for the interaction with PRT5. Immunoprecipitation followed by Western blot analysis showed that the interaction of PRT5 with SMAD3 is observed in both HEC293T cells and cardiac fibroblasts. We hypothesize that PRT5 mediated SMAD3-related fibrotic gene transcriptions. So we determined PRT5 recruitment and histone methylation. Chip assay revealed that PRT5 was recruited by TGF-beta stimulation, but SMAD3 knockdown significantly inhibited this recruitment. Also, SMAD3 knockdown reduced H3R2 demethylation by TGF-beta stimulation. These data suggest that SMAD3 binds to PRT5 and is required for PRT5 recruitment to promote regions. It has been reported that H3R2 demethylation promotes WDR5 ML1 induced H3K4 polymethylation in cancer cells. So next question is this interpret also causes in cardiac fibroblasts? We then investigate the histone crosstalk in cardiac fibroblasts. H3K4 polymethylation was increased by TGF-beta, but this increase was inhibited by M102 WDR5-ML inhibitors. Interestingly, PRT5 inhibitor EPZ also inhibited the TGF-beta induced H3K4 polymethylation. This result suggests that PRT5 induced the H3R2 demethylation and causes H3K4 polymethylations. We then examine the effect of MA102 on myofibroblast differentiation in cardiac fibroblasts. As a result, MA102 treatment significantly suppressed fibrotic gene expression and alpha-SMA expression. So we then examine the effect of ML1 and WD1 knockdown on myofibroblast differentiation in cardiac fibroblasts. As a result, This knockdown significantly suppressed alpha-sigma expressions. Finally, we studied the effect of PRT5 inhibitor on pressure overload in this fibroblasts. EPZ PRT5 inhibitor treatment significantly suppressed the left ventricular dysfunction and cardiac fibrosis. So we summarize our study of PRT5 in cardiac fibroblast. PRT5 is required for pressure overload to induce cardiac fibrosis and left ventricular dysfunction. PRT5 is required for TGF-beta induced myofibrosis or differentiation. PRT5 methylated H3R2 and then WDR5-ML1 methylated H3K4 as a promoter site of fibrogene in response to TGF-beta stimulation. WDR5-ML1 region methyltransferase inhibition suppressed the TGF-beta induced myofibrosis differentiation. PRT5 inhibitor suppress pressure overload induced cardiac fibrosis and heart failure. So taken together, PRT5 methylated H3R2 at the promoter site of fibrogenes. This system marker activates fibrogene transcription and myofibrosis differentiation during left ventricular remodeling. In conclusion, PRT5 plays an essential role in cardiac fibrosis by modifying histone methylations. Further examination is required for the establishment of therapy for HFpEF. Thank you very much for attention. 谢谢。